This is FX Medicine. I'm Andrew Whitfield Cook. We're at the 2017 UIC Symposium in Melbourne, Australia, and I'm here talking with Laura Bryant, who's a patient who's gained benefit from medicinal cannabis. Now, Laura, hi, welcome. How are you?
Hi, thanks.
Laura, you come from a place where I used to grow up, and that's Canberra, the ACT.
Yeah.
ACT is a little bit different with its viewpoint from a legal standpoint. Can you take us through that first, please?
Yeah, sure. So cannabis in Canberra has been decriminalised for a long time, but as essentially it means if you're caught with it, it's not a felony, it's misdemeanor, you don't get a conviction recorded.
What happens then? You get a fine?
I'm honestly unsure. I've never looked. I'm quite scared of the law as I source cannabis illegally. So when I first started using it, we did talk to some, because Canberra, everyone knows everyone. So my parents did talk to a police officer, and it's no conviction recorded. I think you still do have to go through the court proceedings. Again, I'm not an expert on the laws of it. All I know is that in Canberra, I'm to an extent lucky, because if I am caught, I'm not going to be prosecuted as a criminal. But it will still be a long, drawn-out process for me.
Yeah. And can I ask, what condition are you treating? What happened to you to lead you down this path to seek medical cannabis?
Yeah, sure. So I have a condition called ankylosing spondylitis, and it's an inflammatory arthritis. And essentially I suffer from chronic pain as a result of that arthritis. I've had symptoms since I was 8 years old. But I was diagnosed in 2012, and when I was diagnosed, my health took a really steep decline. I was in and out of hospital. I was hospitalised over 10 times in a year, and that's because I was needing pain relief. So I would go in for a week on a ketamine infusion, a horse tranquilizer, and I was on biologics. Essentially, the doctors consistently told me when we got second opinions, everything, that I was on the gold standard treatment. I was repeatedly told there was nothing more they could do to me, except my family and I didn't take that as a good enough answer, because I was bedbound. I struggled to finish year 12. It was, considered a miracle that I graduated. I was bedbound. My mum was my full-time carer. My 15-year-old brother was looking after me. I wasn't able to be left at home. We have a 2-storey house, but I had to have a bed downstairs. Multiple times I've had a hospital bed in the house, and it was getting to a point where then I was suicidal. With chronic pain, majority of patients will develop depression as a result. And so to me, that makes it a emergent health issue.
Yep.
And so for us, it was an emergency. So my mum, dad and I came across cannabis kind of all separately. We always joke about how the three of us never slept. We were always Googling, and then, late night, and came across cannabis separately. I'd even emailed the Charlotte's Web people asking for help. And Mum was driving and heard on the radio about the symposium happening in Tamworth. So Mum went along to that, and less than a week later, my dad rolled me a joint in the backyard. It was so surreal, because coming from a good Catholic family, it was very strange sitting there smoking a joint in front of my family. But
this is actually an interesting thing, that it forces people into that.
And it did. I mean, I'm very lucky that I've got the support of my parents, and they're very... neither of them have backgrounds in science. My dad's an agricultural funds manager, but they research a lot, and I'm very lucky to have them, because they would never let me try anything that was dangerous. But since starting on cannabis, it's been really interesting that cannabis has the least side effects. It's the most effective. It's the thing that I say that saved my life. I'm at a point where, I'm looking at going back to studying and working, but I'm still suffering side effects of prescription medication that I've stopped. So, it's we were almost forced into it, but I'm glad we were.
So, what have you gained from attending the United in Compassion conference symposium? I keep saying conference, symposium.
Well, it's so many things. So an issue for me, the reason I've become really passionate about the laws changing is because since the laws have started to change, source. It's so hard to secure a product. But, Dee Dee was talking yesterday about the different ways that the product can change and how it becomes, one strain can become so many different types of medicine. And that's really interesting because when I first started on it, I was in remission. Within a month, I was off the opioids. It had miraculous benefits.
Wow.
But since then, product has been really hard to come by. The medicine's different. It's not having as much of an effect. So I guess they've really filled in the gaps in knowledge for us about why that's happened, but also meeting other patients and experiencing listening to their experiences around the law and the medicine has been really worthwhile. It doesn't feel as lonely as it has been.
How do you feel, though, being a patient in need and having to resort to criminal activity to gain succour for your symptoms, for your disease?
It enrages me. It's, they were talking yesterday in the panel discussion about the Hippocratic Oath is first do no harm. I was recommended by multiple physicians to have a cortisone shot in my lower back. So it required a 30 centimetre needle going into my spine, and they had to pull me in and out of the MRI to get the needle in the right spot. Whenever I'm in pain, I turn inwards, right? I don't necessarily cry out, but my mum, I think, is a little bit traumatised from that because she could hear me screaming. It hurt so much. So how is it that they can recommend I try that 4 times and the benefit is so variable? Sometimes it works, sometimes it doesn't. It's so invasive. Yet I talk to my physicians about medicinal cannabis and the benefits it's had. It's frustrating.
I could give you the word. It's called ignorance.
It is ignorance.
It's ignorance.
And, I've had a specialist liken me using cannabis to treating pain with heroin. Of course, if I get high, I'm not going to feel the pain. But it's not getting stoned and not feeling the pain. It's actually, for me, it's treating the condition I have. It's treating the inflammation, not just the pain.
So let's look at this stigma. Let's look at this high reefer sort of thing.
Yeah.
How have you felt when you have gained adequate pain relief? Are you compos mentis? Are you in control of everything? And
100%. I don't like to drive on OxyContin because I had to withdraw from uni because of the opiates effect it had on my mind. I couldn't hold a conversation. I couldn't be trusted to look after my 4-year-old nephew alone because I wasn't in control mentally, and received no pain relief from it, I might add. But then I take several different products. Some of them have different effects, but one of them I smoke, and you can titrate, you can figure out your dosage. So I can receive more than a superb level of pain relief and still be in control 100%. If anything, it improves my cognition because I'm not focused on the pain anymore. But it's this stigma that I'm smoking it, I'm going to be stoned. And the frustrating thing is I could be taking this multiple times a day and having the best life I could be, but this one particular product is so hard to source. It's only reserved when I'm in extreme amounts of pain.
so a call out to any and all health professionals and politicians. What would you like to say to them?
Get with the program. Recognise the fact that the system you've started to implement, the laws you're changing, it's not working. Look at Canada. They realised it wasn't working, cut their losses, moved on. They need to do that in Australia. What they're doing, it's easy to
criminal.
say. It's criminal. How is it that I'm? It's a human right. I'm lost for words. It's so frustrating. But how is it that all these people are doing what's best for their patients or for their children, but they're seen as criminals? It's frustrating. And it's easy to say as a politician that they're moving at a rapid pace, but as someone who is using this
Well, they
medicine...
are if you're a turtle.
Exactly. And that's the thing, is I'm living this every day, and since the laws have changed, it's been even slower. I can't get hold of product. It's frustrating.
Laura, I've got to thank you so much for being so eloquent and so explanatory in what's happened, how it's affected you. And I really do admire you for what you've given to us today by joining us at the UIC conference. Thanks so much for joining us on FX Medicine.
Thank you so much. Having the platform to be able to tell my story means a lot. So thank you.
This is FX Medicine. I'm Andrew Whitfield Cook.